Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Good morning. Welcome to another episode of We Talk Health. This morning we have some of the various multidisciplinary team members that you may see while you're here during your hospital stay as a heart surgery patient. With us this morning we have Pamela Roberts. Pam is a registered respiratory therapist and a clinical specialist.
Good morning.
We have also with us Jennifer Mealer. Jennifer Mealer is a physical therapist assistant. She works with us on our heart surgery floor. Good morning, Jennifer.
Good morning.
We have with us a registered dietitian, Chrystal Dickson. She's also clinical nutrition manager.
Good morning.
Good morning. And also we have, last but not least, Nicole Conaway. She is a certified exercise physiologist. She sees our patients in the cardiac rehab toward the end of the heart surgery journey. So good morning, Nicole.
Good morning.
So each of us this morning are just going to speak to our piece in the care of these patients. So Pam, I know you see these patients, our heart surgery patients initially, when they come out of surgery and come to the CVICU. Can you tell us a little bit about that stay in the CVICU and the respiratory therapist's role in the care of the heart surgery patient?
Well, the first thing we'll do, we look at the patient's chart and look at their history, see if they have any home breathing treatments or CPAP or oxygen, and then we'll look and see if what we need to set their ventilator on. Because when they first come out of surgery, they're on a ventilator to breathe for them, and as they wake up, we wean the ventilator off. Our goal is to get them off the ventilator in less than 6 hours, and then once they're off, we will start breathing treatments. They're called easy PAPs to help keep their lungs inflated and take a deep breath, because nobody wants to breathe deep after surgery. It hurts. So we help them so they can't get pneumonia or so they can start wearing some of the soreness out.
What can our patients expect from the deep breathing and the coughing and the pain? How do you guys overcome that?
They will receive, of course, pain medication after surgery, and then we teach them about splinting, holding the pillow tight across their chest when they cough. The pain is controlled through medication for the most part.
If you could tell us a little bit about what our heart surgery patients can expect when they begin to wake up in the CVICU and transition over to our step-down unit.
Well, once you start waking up on the ventilator, most people wake up and they're very frightened because they have the breathing tube in and they can't speak, and we have to remind them, this is okay, this isn't forever. As you wake up, the tube will probably make you cough, but if once you're awake and you meet certain parameters, we'll take the breathing tube out, and that relieves a lot of fear.
Sure.
So once they're off the ventilator and that we've started their breathing treatments, physical therapy comes in and starts their initial evaluation and starts exercising with them almost immediately, and then we'll get them out of the bed into the chair, and then you move out of the unit. You will walk out to the step-down unit, which is A2, and that's where the real work starts for the patient.
Truly, truly. That is a goal of ours. We want our patients to be able to walk out of the ICU around to the step-down unit where Jennifer, one of our physical therapy assistants, will begin working with our patients. Jennifer, can you tell us a little bit about your role and what our patients can expect from the physical therapy standpoint on our step-down unit?
Yeah, so after the surgery and you're extubated, we will get you up in the ICU and you will walk out to the step-down floor. We will see you out there every day until you're discharged. We will begin working on exercises and strengthening to build up your endurance so that you can return back home after your surgery. We encourage patients a lot of times to hug their pillow, like Pam said, to splint their chest because you cannot push or pull with your arms until your bone heals. So we really want to express that so that you can follow and not have any other complications after your surgery. We really encourage you to hold to the pillow for your chest incision so that you can squeeze it and help with the coughing so that we can keep that breastbone safe and healing after surgery. We also encourage you to get in your chair with all of your meals, and the nurses can help you with that. We also encourage you to be up back and forth to the bathroom with nurses' help. The more activity you have here, the safer you are once you return home.
Thank you, Jennifer.
Thank you.
A very important role with our heart surgery patient is from the dietitian standpoint. So we have Chrystal. Chrystal, if you could you just kind of explain the dietitian role in the care of our heart surgery patient?
Sure. Well, the first thing we're going to do is we're going to start you on a diet slowly. After you've had surgery, everything is kind of goes slower. So we're going to give you just a clear liquid diet, just something to stimulate your stomach and to wake it up, basically. Once that happens and you move out to the regular floor, then we're going to put you on a heart-healthy diet. So it's going to be different than probably what you're eating at home. You're not going to get those fried foods. You're not going to get that bacon and sausage. You'll notice salt will not be on your tray. So we are going to give you, the kind of diet that we want you to follow once you get home. Now, just remember, a loss of appetite is normal after a major surgery like this. So, we're going to watch you to make sure that you are eating enough and that you are staying hydrated. So you'll have a dietitian visit you. Also, we're going to come in and give you information about the diet. So we're going to explain it to you. We're going to give you information to take home to help you know what foods you should eat and what foods you should limit or try to avoid once you get home.
I know that protein is very important in the healing process. Oftentimes our patients ask, what are some really good sources of protein for those days when you just don't have a big appetite?
Yeah, those, we do want to push the protein. Of course, we want you to eat more of the white meats more often than the red meats. So chicken, fish, turkey, those types of things. Beans are also an excellent source of protein, so we're going to have you have beans. Milk is an excellent source of protein as well, so skim milk that does not have that fat in it. Also, if you are here and your appetite is just not returned, at times a dietitian may recommend a nutritional supplement, something like Boost or Ensure, but that would be something that we would work with your doctor and the dietitian to determine if that was something you needed or not. But the protein is very important for the wound healing, and we want that incision to heal well. So you have to eat for that to happen.
Truly. Can you speak to, because oftentimes our heart surgery patients have a complication of diabetes. So can you speak to the importance of adhering to that diabetic diet in addition to the new diet with heart surgery?
Absolutely. That is a very important part. With the diabetes, carb counting is what we focus on. And so that is watching the amount of carbohydrates. And so you want to stick to a consistent carbohydrate diet. So you want to have a certain amount of carbohydrates with every single meal. So you don't want to eliminate carbohydrates. And you want to make the good choices of carbohydrates. So not the processed type foods. You want to have those whole grains, oatmeals, whole grain breads, a lot of whole grain foods for your carbohydrate sources. Also fruits and vegetables. A lot of times, patients will say, oh, I'm diabetic, I can't have fruit. Fruit it's full of vitamins and minerals, and it's a great food. And even for diabetics, it's something that they should eat.
Excellent. Thank you, Chrystal. Nicole Conaway is one of our exercise physiologists in our cardiac rehab department. So, Nicole, if you could, just tell us a little bit about your role as the exercise physiologist and the heart surgery patient.
So, inpatient, after the patient has had their surgery, we give them a home walking program and just reinforce what the physical therapist has given the patient as far as exercises inpatient to follow up outpatient. And Jennifer may want to speak a little bit more about that.
It's in your heart book that you either got from Heart Camp or at admission before your surgery. So in there are exercises. There's 3 exercises with your arms and 3 with your legs. Very simple, very self-explanatory. You also have a walk-in program in there. It'll be 5 minutes 4 times a day for the first week. Then each week after that, it changes. There are also tips in there for you to follow to maintain your precautions from where your breastbone was cut open from your surgery. So it's very important to read over those. And we go over all of that with you guys before you leave the hospital so that whenever you get ready to start your cardiac rehab program, you kind of have an idea of what to expect once you're down there with Nicole.
Our patients do have something to do in the interim before cardiac rehab.
Yeah, we try to really enforce them and encourage them to do that so that they can get back to their normal activities faster and have less complications once they're home.
So as the patient is doing their home walking program, they'll follow up with their cardiologist and their cardiovascular surgeon, who then referred them to cardiac rehab, generally 4 to 6 weeks after surgery. After the physician has referred the patient to cardiac rehab and we follow up 6 to 8 weeks after surgery, we do an initial history and physical with the patient to get all of their health history and their diet habits. And if the patient needs a dietitian consult or further education, we have educational classes with a dietitian, an exercise physiologist, and generally a psych consult with the patient. Some are individual visits with healthcare providers and some are group classes. But as far as the patient's exercise, we look at their health history and kind of go from there on an individual exercise plan for each patient, which we start out with a 6-minute walk test at the beginning of the program, which is followed up again at the end of the program to see how much the patient has improved with a targeted exercise program for each patient depending on their health history and physical activity level and fitness for exercise. Any joint problems are considered whenever making that exercise plan for each patient. Each patient is monitored by a monitor nurse or an exercise physiologist where we watch their EKG in detail, beat by beat, while they're exercising, and the exercise prescription is adjusted weekly depending on how tough the patient says that their exercise session was and how their heart rate and EKG reflect. If the patient has any EKG problems or chest pain, we notify the doctor and follow up as needed. We monitor your EKG at rest and while exercising, so don't be alarmed if your heart rate goes up while you're exercising. That's part of our goal. If it gets too high, we will have you rest and we will notify your doctor if there are any EKG changes or anything abnormal.
Good. Good to know. Can you speak to the various pieces of equipment that's used in our cardiac rehab program?
Okay. The most common are treadmills, bicycles, resistance bikes, weights, arm cranks, rowing machines, ellipticals, and weight machines.
Good. Wonderful. Thank you, Nicole. Thanks so much for listening to another episode of We Talk Health. If you have any questions, please feel free to email them to wetalkhealthpodcast@gmail.com.